when my wife had a condition called preeclampsia. We were confused and very terrified. We did not know what to do. But Dr. PAMLI really helped us, and we are really appreciative, and we are happy about this. Thanks, Dr. PAMLI. Stay with us till the end.
Kindly watch this video till the end if you have not subscribed to this channel. Click the notification bell written subscribe for more videos that PAMLI Vlogs will post. This is our story. It all begun like this one early morning when I was preparing to go to work. I was pregnant by then. Enjoy watching. Honey, kindly please take me to the hospital. I'm not really feeling fine. I don't know what is wrong with this pregnancy. It is now 20 weeks and it is really disturbing me. Take me to the hospital please. I need to go for checkup. Let's go.
Okay honey, okay. I've noticed for quite some time you have been vomiting and you are just tired and complaining over headache. Let me find my car key and let me take you to Dr. PAMLI so that he can tell us what is happening to you. Maybe it's malaria or typhoid. Okay.
Honey, try driving faster. I'm really not feeling fine. Whoops. I feel like throwing up. How? Honey, drive faster. We need to see Dr. PAMLI. This pregnancy is boring me up. I told you this first pregnancy. This is my very number one first pregnancy and it's driving me crazy. This is not good. Oh, this is not good at all. Honey, I thought I was going to enjoy this pregnancy. Now what is happening?
Honey. Calm down. Trust me. You're gonna be fine. You know you are my love. I love you so much and I can do everything for you. Just calm down. We are almost reaching Dr. PAMLI office. Is going to help us. I really trust him is good at what he is doing. Let's just go to Dr. PAMLI and things will be alright. I love you honey, just stay calm. We are almost reaching. Okay. Honey, I told you this place is very wonderful. Lively and sparkling clean. You know I love good things at Dr. PAMLI. It's very wonderful, and even if you go to his YouTube channel he will teach you very many diseases. For example, gynecological diseases. That's why I trust Dr. PAMLI. Go to his YouTube channel at PAMLI Vlogs and you will really enjoy. I mean it.
Stop it honey, I will watch his videos later, but for now I'm not feeling okay. This headache is driving me crazy. Let's just see him and let's get this done.
Hello my dear. Welcome to my office. My name is Dr. PAMLI. And may I know your name and the reason why you are here?
Thank you, doctor. I'm Victoria Wayne. What is happening to me is that I'm feeling fatigue. I have headache, sometimes I'm vomiting. Sometimes I feel nausea and sometimes blurred vision and dizziness, and on and off I feel difficulty in breathing. I'm also 20 weeks pregnant. Kindly help me doctor, that's why I'm here.
Wayne had called me earlier and how we have talked about this. I'm just going to take your vital signs, that is your temperature, blood pressure, your respiratory rate, pulse rate and your partial pressure of oxygen, just to make sure they are in normal range. Are you okay with that?
I'm okay with that. Just do it, I'm feeling very bad. Few moments later.
My dear, according to your clinical presentations, plus blood pressure, kindly note that your blood pressure is slightly high. It's 150/120, meaning that you are not okay. There are some laboratory tests that I want to carry out so that I may arrive at the correct diagnosis, but I'm highly thinking over a condition called preeclampsia. I'm calling the nurse to take your urine sample and blood.
What is that? Preeclampsia thing. Am I going to be okay, Dr. PAMLI?
Yes, you're going to be okay. Go to Ward 4. I'm going to be with you shortly. But you have to know all about preeclampsia. Okay.
Dr. PAMLI explained to Mrs. Wayne all about preeclampsia and the nurse escorted Mrs. Wayne to Ward 4 for close monitoring and observation as she waits for the laboratory investigations. Meanwhile, Wayne joins her in the ward. Keep watching.
Hi honey, you are back. How did it go?
Honey, I have talked to the doctor and he explained to me what is happening. He has taken my urine and my blood pressure, and he has said that I'm having what is called preeclampsia. I'm hearing this for the first time, and he has explained to me all about preeclampsia, and now I'm all well conversant with it. He has told me to stay here and is going to start medication straight away. Also said that he is going to do full liver function test and full kidney function test just to make sure that I am safe. He also said that is going to do a test called full blood count just to check all my blood parameters, and yes, said that is interested in my platelets level.
My love, I told you that Dr. PAMLI is very wonderful and approachable doctor. I'm now relieved. You are almost killing me. Anyway, is there any drug he has prescribed to you, and have you taken them?
Yes, honey, he has prescribed some drugs called antihypertensives, and he has also taught me hypertensive somebody can use when there is preeclampsia, like hydralazine and labetalol, and also injected me a drug called beta-methysone for fetal lung maturity. My baby is safe now and I'm very happy. He also taught me about the diet that I should be using, that is calcium supplements, and he has also given me some low dose of aspirin, and I used to smoke, and he told me that I should quit smoking and maintain you as my only husband, as my only lover. I love you, honey, for bringing me here.
I love you too, honey. And let's also pray for your quick recovery. Let me just go and talk to Dr. PAMLI so that I can know what are some of the causes of preeclampsia, signs and symptoms, and also management of preeclampsia. I'll see you soon, honey. Just relax, stay calm, I'll be back. Love you. Thank you, Dr. PAMLI. My wife has told me everything concerning preeclampsia. I just want you to shed some light this particular problem so that I can also share with my friends in the office, so that I also be well conversant with what is called preeclampsia. Yes, my friend, you are right. By definition, preeclampsia is a disorder in pregnancy characterized by onset of high blood pressure. That is blood pressure of 140/90 plus. Proteinuria. And begins at 20 weeks of pregnancy and may extend to 6 weeks postpartum, that is, after delivery. My wife was just okay. What might have caused this? Or what are some of the underlying factors, or even risk factors that can cause this particular preeclampsia? I need to know, doctor. My friend, there's no definitive known cause of preeclampsia. But there are factors or risk factors. 1. Abnormal placentation. 2. New pregnancy, just as the case of your wife. 3. Multiple gestation, that is twin pregnancy or triple, etc. Of course, we will do an obstetric scan to verify if your wife is having twin pregnancy or triple pregnancy, etc. 4. Advanced maternal age greater than 35. But here your wife is safe because she only 26 years old. 5. Kidney diseases or having donated the kidney. Yes, my friend, I really love the way you are teaching me. I'm really following keenly. Are there any other risk factors, or there over pre-existing maternal pathology, like hypertension, of 7 to 8-fold risk of developing preeclampsia? Even obesity and diabetes or pregestational diabetes all play a role in the risk factors to preeclampsia. Those who have undergone in vitro fertilization. Immunological factors like our systemic lupus erythematosus, which is autoimmune disorder characterized by joint pain, fever, skin rash and organ damage. Dietary factors like low calcium diet. Multiple partners also, particularly those who are pregnant with different partners. Thank you so much, Dr. PAMLI. I really enjoy this. And how will I know that somebody is likely to have this preeclampsia? Particularly the way you said those who are pregnant at first time. How will I know? Or what are the signs and symptoms of preeclampsia in a pregnant woman? Presentation of preeclampsia. 1. High blood pressure of 140/90 plus. Actually taken at least 4 hours apart. 2. Protein in urine, that is proteinuria, of 0.3 gram in 24 hours. 3. Edema of hand, face, sometimes pitting, characterized by weight gain. 4. Fatigue. 5. Severe headache. 6. Nausea and vomiting. 7. Dizziness. 8. Vision changes like a flashlight, or blurred vision, double vision. 9. Difficulty in breathing, or even shortness of breath. Whoa. Wow. Wow. Nice one, doctor. I'm loving this. But if I may ask, will she be alright? Or what happens when her condition gets worse or becomes severe? Calm down, my friend. We are trying our best for her not to develop what we call eclampsia. That is, severe form of preeclampsia. Let's take a walk so that I can explain to you more about eclampsia. Okay. Okay. Dr. PAMLI. Your wishes is my command. Let's take a walk, at least I can relieve the stress I have because now you've just mentioned another new big term. Eclampsia. Ooh. Yes. Eclampsia. My friend. Severe preeclampsia is characterized by blood pressure of 160/110 millimeters of mercury. On 2 occasions at least 4 hours apart. And also have impaired hepatic function, that is impaired liver functions. And renal insufficiency, in this we consider creatinine in levels may be high. And new onset of cerebral visions. Severe and persistent upper quadrant pain or epigastric pain. Pulmonary edema. Or difficult in breathings, and what we call thrombocytopenia, that is platelets less than 100,000. Eclampsia is a severe complication of preeclampsia. It's a rare but serious condition where high blood pressure, as I have explained, results in seizures during pregnancy. Seizures are periods of disturbed brain activity that can cause episodes of staring, decreased alertness, and convulsions, violent shaking. It may proceed 6 weeks post-delivery. Eclampsia affects about 1 in every 200 women with preeclampsia. You can develop eclampsia even if you don't have a history of seizures. I hope my wife will be very fine. And she will not complicate to this eclampsia. My friend, it's good to know everything because we have also this. HELP is a syndrome characterized by thrombocytopenia, hemolytic anemia, and liver dysfunction believed to result from microvascular endothelial activation and cell injury. The pathophysiology of HELP syndrome is ill-defined. Some theorize that, because HELP is a variant of preeclampsia, the pathophysiology stems from a common source. In preeclampsia, defective placental vascular remodeling during weeks 16-22 of pregnancy with a second wave of trophoblastic invasion into the decidua results in inadequate placental perfusion. My friend, we are going to try our best to manage your wife very well. Wow. Those are big medical terms. As you've mentioned that you are going to try your best. I just wish that my wife get well because she's all I got. I love her so much. Doctor, is there a management of this condition? Can it be treated? And what are some of the preventive measures that we can put into consideration? I need to know all, so that I can share with friends and colleagues. Well, my friend, let's take a walk to the pharmacy so that I can show you all the drugs used in treatment, management and prevention of preeclampsia and eclampsia. Wow. This is wonderful and fantabulous. The arrangement of drugs are just lovely, sparkling clean, and the environment is cool. I love this hospital. Now Dr. PAMLI, you can proceed with management of eclampsia and preeclampsia. Thanks a lot for the compliment. Definitive management of eclampsia or preeclampsia is delivery of the baby and the placenta. It can be via induction or cesarean section depending on the gestation, when the fetus is already mature and how the patient is presenting. But doc, my wife is only 20 weeks pregnant. What will happen to her? The answer to your question is coming in a short while. Drugs we can use, as you can see here, we have methyldopa, nifedipine, IV hydralazine, and labetalol. Also we have a drug of choice in prevention and control of maternal seizure during eclampsia. It is called magnesium sulfate. We will also inject your wife with a drug called beta-methasone, which already she has been given stat dose. Other injection will be after 24 hours. This is for fetal lung maturity and development. Okay, doc. And something on prevention. I'm really ready for it. Antenatal care is very key, and we encourage all women to at least at 13 weeks they should be in the hospital for antenatal care. We will be screening all these women by checking their blood pressure, urine, hemoglobin level, HIV status, VDRL, malaria. Generally we'll do all antenatal profile. Giving low dose of aspirin has 1 to 5% reduction in preeclampsia. Calcium supplement of 1 gram daily also reduces preeclampsia. If your wife is a smoker, she should cease from smoking. And also maintain you as one father, because changing of partners is reported to give more high risk. Ha ha ha. Ha, that last part is very funny. We love one another and we care for one another. Forget about the last part, doc. Let me go and see her now. Thanks a lot, doc. I hope you have learned a lot about preeclampsia and you will be able to share with the community. I'm also coming to the ward with the laboratory results to review your wife and give you way forward. See you shortly. Okay, doctor, I'm very happy that you are explaining all this to me. Thanks a lot. You know, there are some doctors, clinical officers and nurses who do not explain things to their clients, and I'm very happy that you are doing this. And they will also refer to you, my friends or my relatives or my colleagues, all of them, they will come to this facility so that you can manage them the way you are managing my wife very well. Download, train, and also remember to check my videos on YouTube at PAMLI Vlogs and share, like, and subscribe, and also always leave a comment. You know I am your #1 subscriber. And I've turned the bell for more videos that you are posting. And of course I normally follow you. I will really watch all those your videos and I will share with my friends. Let me go to the ward now.
You are back. You took a lot of time at Dr. PAMLI's office. What was happening?
Honey, you won't believe it. Now I'm charged. I'm just like a doctor now. Dr. PAMLI has taught me about preeclampsia, everything I needed to know, right from definition of preeclampsia, signs and symptoms of preeclampsia, treatment and prevention of preeclampsia, and also have just had a new term called eclampsia. I'm very happy. Honey, trust me, you will be fine. You will be really fine.
Thanks so much, honey, for bringing me here. I'm really happy. Even the signs and symptoms that I had, they are going down. I no longer feel that severe headache. Even the nurse has taken my blood pressure and she has confirmed to me that it is now normal. Thank you so much for bringing me here. I really love you. I don't know what I could have done without you. And again, what did you say that YouTube channel for the Dr. PAMLI is called? I want just to watch his videos.
Thanks, honey, for the compliment. His YouTube channel is called PAMLI Vlogs. Kindly subscribe. Turn on bell for more notification. Share, like, and comment in his videos. I really love those videos. They are really helping. I'm just waiting for the doctor to come to review you. Then I will rush back to the office to handle some of the files I left unattended yesterday. Love you so much, honey. Okay, my sweet pie.